Welcome back to Journey to 600. Today we're going to be talking about anatomy of the hip. We'll go through the joint of the hip, kinematics, and the muscles and ligaments. So starting off, the hip joint is the acetabulofemoral joint. And between the acetabulum and the femur is articular cartilage and the labrum. So you have a concave acetabulum and a convex femur, and that is what makes up the hip joint. So motions of the hip is a ball and socket joint, so it has a lot of motions. There's flexion and extension, internal and external rotation, and AB and adduction. So pretty simple, very similar motions as the shoulder. Just a refresher on what the roll and glide rule is. So when you have the concave bone moving on the convex bone, so say the acetabulum is moving on the convex femur, the roll and glide would be in the same direction. But if you have the convex femur moving on the concave acetabulum, the roll and glide will be in opposite directions. So cave on vex is same and vex on cave is opposite. So summarizing that, so again, the hip joint is concave acetabulum and a convex femur. So if you're an open kinetic chain, that would be the convex femur moving on the concave acetabulum. So that means it would be rolling and gliding in the opposite direction. But closed kinetic chain, you have the acetabulum moving on the fixed femur, and that means the roll and glide would be in the same direction. So going back to those osteokinematics, we're going to add arthrokinematics on top of that. So for flexion in open kinetic chain, you will have the femur rolling anterior and gliding posterior. And extension will be the opposite. Your femur would be rolling posterior and gliding anterior. For external rotation, you would have a posterior roll and a glide anterior. Internal rotation, rolling anterior and gliding posterior. And then with abduction, rolling laterally and gliding medially. And then adduction, rolling medially and gliding laterally. So those are the arthrokinematics of the hip, and those glides are associated with the treatment of limited range of motion. Then talking about the muscles that help the hip move. So with hip flexion, you have those front or anterior thigh muscles. So those deep hip flexors are the iliopsoas or the iliacus and the psoas. Then the rectus femoris crosses the hip, so that helps with hip flexion, pectineus and sartorius. For extension, the main one is the glute max, but the hamstrings help with hip extension as well, but it also crosses the knee. For hip external rotation, you got the P-go-go-Q from anatomy, so P piriformis, and then you have the gemellus, superior and inferior. You have the obturators, internus and externus, and then the quadratus femoris. So those all help externally rotate the hip, and those are deep hip external rotators there. For internal rotation, that's going to be the glute min and the TFL. Hip abduction is going to be primarily that glute med, but TFL can help a little bit, glute min can help a little bit. And then lastly, hip adduction is all those adductors, so the adductor brevis, longus, and magnus. Then you also have the pectineus, which helps with a little bit of adduction, and the gracilis. So those are all the muscles of the hip. So just kind of grouping those together can help you remember the muscle action for the hip muscles. Lastly, covering hip ligaments. So there's 3 primary ligaments that help give stability to the hip. So you have the iliofemoral ligament, which is the wide ligament, or that red ligament pictured here. So it is on the anterior aspect of the hip, so it's going to prevent hyperextension and external rotation. The pubofemoral ligament is anterior-inferior aspect of the hip. so it's going to prevent extension and abduction, so it's that green ligament there. And then the posterior ligament, the yellow, is the ischiofemoral ligament. It's on the posterior aspect, so it's going to prevent internal rotation and adduction with flexion. So those are the 3 ligaments that provide stability to the hip. Lastly, the practice question. So a patient presents with limited hip extension. When assessing joint mobility, you noted hypomobility. Which of the following interventions would improve their range of motion? A, anterior glide of the femur, B, posterior glide of the femur, C, stretch glute max, or D, stretch iliopsoas. I'll give you a moment to answer. Please pause if you're not ready to review. So this question says they have limited hip extension. So a lot of things can limit hip extension. It could be either the joint or it could be muscle. But in the question it says when assessing joint mobility, you noted hypomobility. So you are checking interarticular motion, or you're checking joint mobility, and it was limited. There's no test for muscle length here, so we're not sure if it's due to muscle length. So which of the following interventions would improve the range of motion? So you can mark out C and D because it does not mention any kind of muscle length test. So we're probably going to pick between an anterior glide or posterior glide of the femur. So hip extension, that would be a roll posterior glide anterior. So A is the best answer. Anterior glide of the femur would improve mobility at the hip joint and would increase hip extension. Thanks so much for watching. Don't forget to like this video, subscribe to our channel, and turn on notifications. See you next time on your journey to 600.